Wastewater is showing a decline of the Omicron variant in some states across the U.S., but hospitalizations are still high. We've got Dr. Kumar joining us this morning to talk more about this. Good morning, sir.
Good morning, Casey. Nice to meet you.
Yeah, you too. So talk about this wastewater thing. A lot of people might be hearing this going, what in the world are you talking about? It's been helping scientists determine the levels of COVID-19, wastewater.
Yeah, we talked about it last week as well. And, we can test the burden of COVID in the wastewater and sewage because we shed it in our stool as well as cough it up. COVID infects all parts of our body. And so we're testing wastewater and we're finding that there's a decline, and it's actually translating real time. Wastewater testing, as we discussed, kind of precedes the surge and also predicts the end of the surge. And so what we're seeing in wastewater as well as clinically in our hospitals was that we've made the turn. And if you look at the graph of even here locally in Austin, you'll see that now the graph is starting to decline, which is good news. But yet, even though we're declining and we're on the way down from the surge, today the 105 admissions a week rotating 7-day average is still higher than any time during any of the other surges. So we're still at a record kind of high, but the news is good. We just need to have a little bit of patience because things are starting to get better.
Yeah. Do you have any idea if it's detecting this new variant yet anywhere?
Yeah, we do. We believe that it is, in fact, reflective of Omicron. And, whenever a person gets admitted to the hospital nowadays, you get tested for COVID. And so the difference between these surges and prior surges is that with Alpha and Delta, oftentimes the people that were getting admitted with COVID were getting admitted for COVID. But now, since we test everybody and there's, people getting admitted for heart attacks and strokes and orthopedic procedures, and you test them all, and many of them test positive for COVID, they're getting admitted with COVID, not for COVID. And so exactly what percentage accounts for just asymptomatic, happen to randomly have COVID while they're admitted to the hospital versus those that are specifically admitted for COVID, we don't keep that kind of data. It's hard to decipher, but word on the street, on the ground level, we're seeing a lot of that action. So that can also reflect this huge numbers of COVID in the hospital. But the news is starting to get better. So if we just have a little patience, keep doing what we're supposed to do, wear our masks and wash our hands and be safe, that we can get through this.
Yeah, the wastewater thing is fascinating. How do you think it will help with future variants of this thing?
Yeah, like we talked about, how this wastewater data predicts the next surge. So this Omicron, like in the middle of December in San Diego, long before this uptick happened, they reported that they saw the highest burden of COVID in the wastewater since they started keeping records, which was in mid-2020. And so wastewater data is going to go a long way of predicting, like a week or two or three ahead of the next surge that it's coming. And when we know that the next surge is coming, that's the kind of time that we can kind of dial what we already know to do, all these safety measures. And understandably, when, the levels are low, we kind of take our masks off, we gather with our friends, and it's safe to do that. The prevalence in the community isn't that high. But then with wastewater data, if we start seeing these numbers climb, then we can start preparing ourselves, start dialing our safety measures a little bit stricter. And so that does foretell what's going to happen in the future and helps us plan our own measures personally and as a society, how we deal with it.
Yeah. Well, glad that there's light at the end of the tunnel. Dr. Kumar, thank you so much. And if you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. And you can check out his website, drkumar.com. We'll be right back.